Today, we join the rest of the world in commemorating World AIDS Day under the slogan, "Everybody Counts." We stand in solidarity with those who have become affected with HIV and remember those who have died from AIDS-related illnesses. AIDS is a word which evokes as much fear as it does stigma and discrimination. Until the day an effective cure is developed, awareness and prevention are our best defense against this pandemic. Globally, we are seeing that countries are getting on the fast track to end HIV/AIDS by 2030 as part of the Sustainable Development Goals. As a result, millions of people are on life-saving HIV treatment. Correspondingly, within the Caribbean, 6 countries have eliminated mother-to-child HIV transmission. Regionally, we're making huge strides. Still, over the past 5 years, the decline in HIV infections in adults has stalled. At the end of 2016, the prevalence of HIV in the Caribbean was 1.3%. or 310,000 persons living with HIV and AIDS. Most of the cases occurred in 5 Caribbean countries, with Haiti accounting for almost half of the cases, followed by the Dominican Republic. These statistics prove that we must renew the call to action to address and reinvigorate efforts. We have seen an increase in biomedical and scientific advances that can allow HIV/AIDS positive persons to live long, productive lives. This includes the antiretroviral treatment that can effectively prevent the HIV infection and decrease the risk of HIV transmission, as well as treatments that are bringing us closer to eliminating HIV from an infected person's body. In Belize, the national response to HIV/AIDS, which is coordinated by the National AIDS Commission, has made significant strides in guaranteeing that every person has access to life-extending information so that they can access treatment, care, and support services regardless of age, gender, race, ethnicity, sexual orientation, gender identity, or socioeconomic status. Free HIV testing and epidemiological data have allowed us to focus our attention on districts with the highest burden of HIV incidences. Still, more work remains to be done, and more investments are needed from the various sectors of society in order to embark on a fast-track strategy to end the AIDS epidemic. The government of Belize has committed to additional investments in HIV/AIDS as a testimony of their seriousness in putting an end to HIV/AIDS epidemic through a fast-track strategy developed by UNAIDS. Belize is also on track to eliminate mother-to-child transmission of HIV/AIDS. As the chair for Spouses of Caribbean Leaders Action Network, and through the established She for Belize Foundation, I will be advocating for access to safe, effective HIV screening, medication, and services for all citizens. I am pleased that spouses and first ladies of prime ministers and presidents of the Caribbean have also made a commitment to the 1990-90 target to have 90% of people living with HIV diagnosed by 2020. 90% of diagnosed people on antiretroviral treatment by 2020, and 90% of people in treatment with fully suppressed viral load by 2020. The success we have achieved thus far gives us hope for the future. But as we look ahead, we must not be complacent. This is the time to move forward together to ensure that all children start their lives free from HIV, that young people and adults know their status, and if necessary, begin early treatment so that they can live productive lives. On this World AIDS Day, I call for more engagement from people living with HIV. The role of the wider civil society is invaluable in strengthening policy development, capacity building, and human rights protection. Collectively, we must foster an environment that lowers stigma and discrimination, since these factors impede access to vital health and social services. We should be reminded that all persons, including the LGBT community, have a right to health, because everybody counts. We can make a difference in strengthening HIV prevention efforts so that we may reach a day when there is zero discrimination, zero new infections, and zero AIDS-related deaths. Thank you.